Most people think they know what keeps bones strong. Take a calcium supplement, drink some milk, walk a little every day, and you're set, right? But here's the truth. Bone strength depends on load, and certain exercises can actually help you build and keep bone density as you age, while others don't do enough at all. Here's the part most people miss. Even if you walk daily, you might still be losing bone mass faster than you think. And the single biggest mistake I see patients make with bone exercises, the mistake that can cancel out months of effort, is something I'll explain at the very end, so stay with me. First, let's talk about why this is so important. In my practice, I see older adults every week who've had a hip fracture or a spinal compression fracture, and for many, it's the start of losing independence. They were living normally until one fall changed everything. I saw this happen to my own mother, in fact. Most of these fractures don't happen from car accidents or huge trauma. They're called fragility fractures, which means normal bones shouldn't break so easily. In my mother's case, it was one step that she took just the wrong way, the hip broke, and she went down. And that led to surgery, hospitalization, the rehabilitation center, etc. It was months of difficult, excruciating pain, and in fact, it was touch and go there for a while in terms of life and death. And in an elderly person, that's not uncommon. So this is when osteoporosis is at work. Worldwide, millions of people live with osteoporosis. It also has an early stage that we call osteopenia. And you can have this without even knowing it. Here's the thing. We peak our bone mass in our late 20s or early 30s. And after that, we naturally lose bone. Slowly at first, then faster with age. Bone loss is mostly silent. You won't feel it until something cracks, something breaks, something gives. In fact, many times people believe that they fell and broke their hip, when in fact what happens is they break their hip and then they fall because the hip has broken. Some of the key drivers in this thinning of the bone and weakening of the bone is hormones in women. Falling estrogen after menopause speeds up bone thinning. In men, gradual testosterone loss plays a role too. With regard to nutrition, not enough calcium, vitamin D, or protein all make normal bone maintenance harder. Low activity is important also. Our modern lifestyle typically involves sitting at a desk, working on screens, and this robs bones of the good stress they need to stay strong. What about medications? Well, there are some common medications like long-term steroids, which can weaken bones if they're not managed very, very carefully. Here's the science I want you to remember. A bone is not static. It's not a piece of wood. It's not a piece of chalk or concrete. It's alive. It's a living part of the body, and it rebuilds itself constantly. It's a dynamic organ system, just like your muscles or your heart. If you load it, it adapts. If you stop loading it, it weakens. This is why astronauts lose bones so quickly in zero gravity. It's a really fascinating aspect of space travel, and one of the limiting aspects, in fact. With no weight pushing back, the body says, we don't need this dense skeleton anymore, and it begins to allow that skeleton to deteriorate and break down and basically evaporate. It's the same idea if you sit all day every day. Now, walking is excellent for your cardiovascular health, and anybody who watches my videos knows that as a cardiovascular surgeon and a vascular surgeon, I am a huge proponent of walking. I think it is an absolutely phenomenal exercise. I think it's one of the very best things you can do for your health. You know, it helps your circulation. It helps with your blood pressure. It helps with weight control. It helps with cardiopulmonary endurance. It's a fantastic, fantastic activity, walking. But when it comes to bone, normal daily walking usually isn't enough to load it and to prevent that gradual loss. Your bones need an impact signal or tension from muscle pulling against it. That signal tells the bones, hey, you better stay strong. We need you. You better toughen up. You better thicken up. You better be ready to stand up to the work we're doing. Let me make this simple. You have two main ways to stress bones safely. The first is weight-bearing impact. Anything where your feet hit the ground with force. Brisk uphill walks, hiking, stairs, dancing, even taking small hops or jumping rope or making believe you're jumping rope, which is another great thing to do so that you don't trip and fall. The impact is small, but it signals the bones to adapt, to thicken, to harden, and to grow and stay strong and healthy. Second thing is resistance training, lifting weights. using bands or doing body weight moves that change and challenge your muscles. If you're challenging your muscles to grow, you're challenging your bones to stay strong. When muscles contract and pull on tendons attached to the bones, that tension stimulates the bone to strengthen at those spots. It's really very, very important. Here's something many people overlook. It's not just the strength of your bones that keeps you safe, it's the strength of your muscles too. Tendons, ligaments, all of that is important. And as we get older, we naturally lose muscle mass. That process is called sarcopenia. It's common after the age of 50, and it speeds up if you're not active. Less muscle doesn't just mean less strength. It affects your balance, your coordination, and your reflexes as well. So that's something to really keep in mind. It's so important. This is also why older adults are more likely to trip and slip. And when that happens, weak bones plus weak muscles is a recipe for fractures. And by the way, fractures and breaks are the same thing. Some people will say in my office, a patient will say, "Oh, thank God I just had a fracture and it wasn't a break." A fracture is the medical term for a broken bone. Now, you can have a hairline fracture, which is minimal or minor, and you can have a complete fracture, which is obviously much more traumatic and more painful and takes longer to heal and can even require surgical repair. But a fracture is a break. Keep that in mind. Now, let me tell you what the research shows. About 90% of hip fractures in older adults happen because of a simple fall, not because of a huge accident. Want to know the good news? The good news is that strength training helps on both fronts. It strengthens the muscles that pull on the bone, and it trains your balance and reaction time. So every time you build and maintain muscle, you're protecting your bones in two ways. You're adding healthy stress that keeps bone tissue dense, and you're lowering the odds of falling in the first place. One study that really highlights this point is the FROST trial, done by researchers in Germany. They worked with older men who already had lower than normal bone mass, the group we worry about most for developing fractures. Instead of just giving them stretching or light walking exercises, they supervised progressive resistance training plus light impact moves like squats, lunges, overhead presses, and carefully controlled jumps, twice a week for a full year. The results were really impressive. The men gained bone mineral density in the spine, improved strength, and reduced their risk of falls, all without serious injuries occurring. This shows that with the right plan and supervision, even older adults can safely load their bones and actually maintain or improve bone strength. Not just slow the loss. That's an important distinction to make. They can increase their bone strength and health, not just slow the loss. Some patients ask me, "Doc, but isn't lifting heavy dangerous for older bones?" And that's a really smart question. And generally, early on, it's true that can be dangerous. But here's the reality. When done correctly, resistance training is very safe, even for older adults with lower bone density. And you need to build up the strength little by little. You don't want to start at highly intense levels right off the bat. And you'd like to do this ideally under supervision. In the FROST trial, older men did high-intensity strength training and light impact exercises for a full year under supervision. The researchers reported no serious injuries, just minor muscle soreness, which is normal when your body adapts to new training. Their safety came down to three things. Number one, they started at an appropriate level for each person. Number two, they learned good form first. Number three, they progressed gradually, not overnight. There's no rush here. So if you're new to weights or have osteopenia or osteoporosis, it's really smart to work with a trainer or a physical therapist who understands bone health. And always talk to your doctor first, especially if you've had a spine fracture or you're known to have severe bone loss. Safe progression is the key. So what should you do in real life? Well, keep walking. It is good for your heart, your mood, your weight, your blood sugar. Then add resistance training. 2 to 3 times a week. Focus on full body moves. For example, squats, lunges, presses, rows. And then if safe, add light impact. Stair climbing, low jumps, gentle hops. Remember, don't use a rope if you're worried about tripping. You can make believe you're jumping rope just as easily as you actually jump rope. In fact, this can allow you to go a little bit longer sometimes without missing a jump. Also, remember to use progressive overload. Gradually increase the weight or the reps as you get stronger. Here's the most important piece. The one thing that cancels people's progress. They stay static. They don't move. Your bones and muscles need a changing stimulus. Lifting the same dumbbell for the same reps forever is not going to be helpful. You're going to plateau. So make small, safe progress. Add a little weight, increase the reps, change the angles. That's what keeps your skeleton responding and your bones strong. Of course, all this only works with the right fuel. Get enough calcium, dairy, leafy greens, and fortified foods. Get your vitamin D, sunshine, or a safe supplement if needed. Eat enough protein. Your muscles and bones depend on it. Quit smoking. Absolutely quit smoking. Not just for your bones, but for your survival, for your quality of life, for your lung health, pulmonary health, cardiovascular health. Quit smoking. Nicotine weakens bone repair. If you drink alcohol, keep it moderate. High intake is linked to weaker bones. Always talk to your doctor if you have a history of spine fractures, severe osteoporosis, or balance problems. Sometimes you'll need a bone density scan called a DEXA scan to track your progress. And if you're not sure what exercises are safe for you, ask for a referral to a physical therapist who works with bone health. If you've ever worried about fragile bones or know someone who's had a hip fracture, I hope this gives you confidence that you can do something about it. Weight-bearing impact and resistance training are smart and safe, especially when you're consistent. Add that to a good diet and a healthy lifestyle, and your bones will thank you for years to come. Hey, if this helped you, please share it with a friend or family member who wants to stay active and strong as they age, and someone who wants to stay safe, someone who wants to stay out of the hospital, out of the operating room, and out of the rehab center. Drop a comment below. Do you strength train? What works for you? I read every comment. Like and subscribe for real, clear medical information you can trust. I'm Dr. John Chuback, and I will see you next time.